Do you work in clinical dentistry? Did you know that 90% of dentists, hygienists, and assistants are in pain? If you work in dentistry, you know how physically demanding our job is. We not only have to deliver a high quality of care and keep our patients comfortable, we have to somehow take care of this as well. For many of us in dental, we're both perfectionists and caretakers, which is great for our patients, maybe not so good for us when it comes to taking care of ourselves. If you think about it, our body is our most important instrument. And if we aren't taking care of it, we're not going to be able to practice for as long as we want to or deliver the quality of care that we would like. Hi, my name is Stephanie from Polished Posture. I'm a dental hygienist and ergonomic specialist. Here we talk about how to be more ergonomic and have great posture, whether you're seeing patients or working on your computer. Today's video is focused on dental workers, and we're going to be talking about neutral posture. Plus, I've got a great exercise at the end that's going to help you feel good and have really good posture. What is neutral posture? Neutral posture is the position of our body where we have the most support with the least amount of muscle engagement. If you think about it, our bones are nice and thick and hard and they don't fatigue. We want to use our bones when we're holding ourselves upright, whether we're standing or we're sitting working on a patient. When our spine is aligned in neutral posture, we can hold that seated or standing position for a long time without getting tired. When we're in an awkward posture, which is anything outside of neutral, our bones are no longer doing the work. Our soft tissue is. And our soft tissue, our musculoskeletal system, is designed to help us move through space, not hold us in these crazy weird positions for hours a day. That's why we get tired and injured, because we're asking a system to do a job that it is not designed for. So what's the goal? Be in neutral posture as much as you can during the day. Whether you're seeing patients, walking down the hallway, driving your car, looking at your cell phone, you get the idea. So what does neutral posture look like? It's pretty easy to understand from the profile view. So from the side, you want your ear in line with your shoulder, hip, and foot if you're standing. For most of us, that means moving our head horizontally back to get our ear in line with our shoulder. So if you're standing, I should be able to come and put a yardstick up next to you and it would hit your ear, shoulder, hip, and foot all at the same time. If you're seated in the operatory, the concept is pretty much the same. Ear in line with the shoulder and hip, but this time you want your feet flat on the floor, not crossed, not up on your tippy toes, flat on the floor. When you're working on patients, you want your arms close to your sides with your elbows bent at about 90 degrees. Pro tip, when you're in neutral, look down at the level of your elbow. That's where you want the patient's mouth to be. Many times when I'm working with clients doing assessments, the patient is positioned too high. So lower that patient down so their mouth is at the level of your elbow. What happens when we're not in neutral posture? For example, if we're in something called forward head position. If you've heard of text neck or tech neck, that's what this is, when your head is in a forward head posture. For every inch the ear is out in front of the shoulder, that's adding an additional 10 pounds of pressure to the spine. For some, that can add up to 20, 30, 40, 50 pounds of extra pressure to the spine for no reason. Think about hanging several bowling balls worth of weight around your neck. That's the strain that you're putting on your spine when you're hunching over looking at your patient. Our body is adaptive and it responds to what we're doing. So the longer we're in that position, that forward head position, our body will start laying down tissue to hold us in that position to where we wouldn't even be able to stand up straight if we wanted to. Have you heard of the dental hunchback? That's how this starts, with forward head position. No one wants that. So here's an exercise that will help you counteract the effects of forward head posture and strengthen your muscles and remind your body where you want your head, which is up and back, not forward and down. It's called the cervical retraction. So if you're in a relaxed position, most of us, that means our head is forward, you want to horizontally move your head back towards your spine to get your ear in line with your shoulder. At the same time that you're moving your head back, you want to think of lifting through the crown of your head. So let's do one together. We're going to be in a relaxed position. Now you're going to move your head horizontally back towards your spine. Think of lifting. And if you're doing this correctly, you will feel muscle engagement all the way down your back. So you're going to move it back, hold it, then relax. Move it back again, hold it, and relax. So that was a couple reps. I recommend doing a few sets of 15 reps per day. This is really good for us in dentistry. It strengthens those tiny little stabilizer muscles in our neck and our back, and it just works on muscle memory to remind our body that we want our head up and back, not forward and down. Constantly reminding yourself where you want your head, whether you're driving your car, working on your laptop, cell phone, patience, whatever, keep your head back. And the more you do it, the easier it will be, and then you won't have to remind yourself at all. This is a habit that you want to build and master over time because it's going to help you reduce your pain and injury and prevent that dental hunchback that no one wants. If this video was helpful, hit the subscribe button and stay tuned for more ergonomic tips.